Hi, this is Suzanne Bowe. I'm doing Nursing 1 Skills Validation for oral medication administration. The first thing I would do is make sure that I have the appropriate supplies, my MAR, my chart, and my Cardex. And I would be administering the 9 o'clock morning meds. The first thing I would do is I would go to the nurse's station and I would look at my MAR. I would make sure to look at the current medications that are prescribed and when they are to be taken, and I would also look at any PRN medications and when she last received them. The second thing I would do is I would check the physician orders to see if there are any new orders for this patient. And then I would go ahead and cross-check the MAR with the Cardex. I would check to make sure every drug was the same and the route and the time and everything was all the same. If there's any discrepancies, I could check the chart, or I could call the physician, or I could call the pharmacy. That is my first check. Okay? And then after that, I would go over to the Pyxis, which is, in some hospitals, it's a computer where you stick your thumb on it, identifies the nurse, and then you can punch in the appropriate medication you need. A drawer would pop out, and I would get the appropriate medication. Okay? Once the medication, I received that, I would again check that against the MAR to make sure that I have the appropriate meds. And at this time, I'd also check to see if I need to perform any dosage calculations, or I need to split any pills or crush any pills. If pills do need to be crushed, I would crush them in applesauce. Okay, so this is my second check. I would take the MAR, the record, and the chart in with me to the patient's room. I would walk into the room and I would greet the patient. Good morning.
Good morning.
Hi, I'm going to be giving you your meds this morning, and before I do that, can you verify your name and date of birth?
Donna Larson, January 1st, 1942.
Okay, that's one check, and I could also check her medical ID bracelet against the MAR to make sure that I do indeed have the appropriate patient. And at this time, I would also have to make a note of this is a medication that requires a blood pressure check, so I would make sure that I checked this patient's blood pressure, being that I am going to administer lisinopril. So I would check it. If it's in normal range, then I would say, okay, Donna, the first medication I'm giving is your lisinopril. I make sure that she swallows the pill. That's the only medication she has prescribed on the chart. But then I would also ask her, are you in any pain?
Yes.
And could you rate your pain on a scale from 1 to 10 for me?
An 8.
Okay, so she is in pain, so I'd ask her, would you like an Advil?
Yes, please.
Okay, so I'd give her the Advil. Then I'd make sure that she swallows that, and I could do a follow-up assessment and say, is there anything else I can get you?
No, thank you.
Okay, and then, of course, the patient would be in bed. I would reposition her comfortably, and I would go ahead and I would chart that I indeed did give her these 2 medications. I would chart that on the MAR, and then I would also go ahead and go back to the computer and chart that also. This ends the oral medication administration.